So my name is Ewelina Rydzewska, and up until recently I was a research fellow at Glasgow University. Now I work as a lecturer at Edinburgh University, but I'm still an affiliate staff member. So at the end of the session, I'll share my Glasgow contact details as well, so you can still reach me on my Glasgow email address without any problems if you've got questions after the session. So without any further ado, today we're going to talk about systematic reviews. We're going to focus on that. And I think I should probably start by saying that there are several different types of reviews, starting, with narrative reviews, rapid reviews. There's something that's called systemized reviews. And please don't ask me about the details because I've never done a systemized review, so I actually don't know very much about them. But I personally have experience in the last three types of reviews: systematic, meta-analysis, and umbrella reviews.
Sorry, yeah. Your slides are on presenter mode at the moment, rather than the full screen.
Right. Do you want me to try and change that? How do I change that? Does anyone know?
I don't know how you do it.
Presenter view, no. Okay, I'll stop sharing for a second. Maybe custom.
Ewelina, if you start the presentation.
Yep.
To start the slideshow.
Yeah, so I'm clicking on that, but nothing's happening. Resume slideshow. Yeah, nothing's happening now.
Okay, I don't know that bit.
I wonder if that's because I've got two screens.
Yeah, I was going to ask you, perhaps if you are sharing the other screen,
Yeah, is that better now?
That's it sorted.
Yeah,
it's fine now.
Full screen. Okay, that's great.
Yeah, thank you.
I've got two monitors, that's well. So yeah, where was I? I think I was talking about different types of reviews. So I particularly have experience in doing systematic reviews, meta-analysis, and I've also done an umbrella review, which is a review of systematic reviews and meta-analyses. So that's like the highest level, I guess the highest meta level you can go to. But today we'll be talking about systematic reviews only. Now it's not letting me skip the slides. Okay, that's fine. So if you want to find out about the other different types of reviews, there's quite a few different articles online that you can have a look at, and some of these mention as many as, I believe 9 or 14 different types of reviews, some of which I haven't even heard of before, to be honest. But here's just some references for you guys if you want to follow up on them and read up about different types of reviews if you ever need to. So let's talk about the systematic review in detail then. It's called systematic for a reason. It does include a very systematic method of searching, of appraising your studies and synthesizing any findings. So there's always a set guidelines, principles that you have to follow, and these don't change that much, if you like, even depending on the different kind of review questions that you want to answer in your review. There's still a certain standard set of guidelines that you have to follow for a systematic review, and we will talk about those today and different stages of the review. Once you know what you're doing for your review, if you want to publish it, you do have to register it with a site that's called and it's a prospective register of systematic reviews. And I will get back to that at the end of our talk, and there's a reason for that. So just keep that in mind. I'll talk about it a little bit more later on. But a systematic review can include studies with a wide range of study methodologies. So it doesn't necessarily have to be a systematic review of quantitative studies only. You could have both in one systematic review. So it's worth kind of remembering that, and I think it's a big plus side to doing a systematic review. But there's also a big downside, which is the fact that it's very time and resource heavy. And from my own experience, systematic reviews have easily, in the past, have easily taken up to 2 years to complete and then publish also. The process of publishing can be grueling, as with any manuscripts, I think. But it's just, you just need a lot of time and resources to do a systematic review. So it's worth remembering that, particularly for those of you who are supervising students who are doing systematic reviews. I think it's worth.
Can I call you back in like an hour? I'm just in a Zoom meeting.
Can I ask you all, if you're not speaking, can I ask you all to put yourself on mute?
Now, or what are you doing?
Somebody's not on mute.
Okay, it's just over at 2 o'clock, so I'll give you a call after it's done. Okay, bye. Okay, talk to you soon. Bye, bye.
Whoever was taking a call just now, you weren't on mute. Sorry, I can't see you guys, so I don't know who was talking. Can you put yourself on mute? Okay, hopefully that's sorted. As I was saying, if you're supervising students, it's worth to keep that in mind, that it is easy for the systematic review to kind of become this really big thing that's that not very manageable in the timescale that they might have for student projects. Okay, just move on. Okay, so what makes a systematic review truly systematic? So first of all, you do have to include several different databases that you will be searching in your systematic review. At least, I would say 3, if not 4 or 5, depending on the subject and and the topic you'll review questions. And these have to be subject specific. And you can, if you go to the library web pages, you can, I'm sure you know this, but just as a reminder, you can search for databases by name, but also by subject. So that helps you find those ones that might be kind of specific to your subject. And it's good to kind of choose also, apart from very subject-specific databases, it's also good to choose those ones that might be quite broad in the type of studies or in the type of articles that they will be including, such as Web of Science, for example. It has all sorts of papers. So it's good to include those in your search strategy too. And of course, you will have to come up with a very comprehensive set of search terms, and we will talk about that later on, so I won't go into detail just now, but it does have to cover all of the areas, all of the different concepts that you are looking to explore in your review. And if you, for example, if your kind of methodology of interest in terms of the relevant studies that you would be looking for, if these are clinical trials, then it's good to also include clinical trial registers in your systematic review search strategy. The library advice within the college is also to include grey literature, and that includes things like student dissertations, conference abstracts, for example, or any maybe reports, government reports, that wouldn't have been peer-reviewed. I personally would disagree with that. I never include grey literature in my own reviews. I've never done that. I've never advised my students to do that. I always just focus on peer-reviewed research. So it's something for you to think about, and we can discuss it later on when we have some Q&A time, in case you've got any strong thoughts about this. The other thing that the library suggests to do is to contact authors for those papers where, for example, you think, once you start reviewing your search results, where you think they might be relevant to your review, but the paper doesn't quite maybe exactly provide all of the details you need. So you kind of want to follow up a little bit and, you know, find out more about the findings that they might have got in the study. Again, I never do that. If the paper doesn't report something, they don't report it, and that's it. I just draw a line there, but it's something to consider. Are there any questions up until this stage about any of this? And feel free to give me some audio feedback, because I can't actually see you guys on my screen. Can you still hear me well?
Yes. Once I tried to contact an author, but I got no reply. So yeah, I think it's difficult after they publish their papers, like, to share more information.
Okay, yeah. Of course, you have to face the fact that you know, some authors might not reply, for example. So yeah, you have to keep that in mind. But yeah, I've actually never personally done that. Okay, thanks for that. Any other questions before I move on? No? Okay, so I'm just gonna go to the next slide. How do you start your systematic review? Where do you start? Well, I guess that kind of depends. That depends on the level of your knowledge about the field already. If you've worked in it before, if you've done any research on it before. Obviously, if it's a student project, the students might not know that much about the topic. But I think a good starting point always, regardless of your level of experience, is to do something. Well, I actually have a kind of a strategy that I always follow. So my tip would be to go to places like Google Scholar, or for example, Cochrane database of systematic reviews, and also Prospero, to look for any previous systematic reviews that have been done, maybe in the area of interest that you are possibly wanting to look at, or if there are any relevant papers that you possibly would be including in your systematic review if you were to follow that particular topic of inquiry. And a good rule of thumb, I think, is to not do a systematic review if there has been one done already in the last 10 years. I just don't see, personally, I just don't see any point in doing, you know, another systematic review on the same topic that has been reviewed in the past 10 years, unless it's maybe in a field of kind of scientific inquiry where things move on really, really fast. So I don't know, in fields like maybe informatics, for example, where there are new discoveries all the time, new technologies to review, maybe it's worth doing systematic reviews quite frequently. But in public health, where I'm kind of based, it's not necessarily the case, at least not kind of in my area of expertise. It hasn't been. So I would say just check how recent any existing systematic reviews may be. And if you, for example, use Prospero, you can also check on there if the review has been completed or not, if it's still ongoing. So it's worth keeping in mind that other people might be doing exactly the same systematic review at the same time as you doing yours. And, you know, you might end up publishing at the same time as well. Or they might actually published before you, something else to keep in mind. So I guess I always try to think of that and go by that rule. The other good place to start, obviously, if you've not done a systematic review before, is to have a look at some of the library resources. Excuse me. They will just kind of help you think about, first of all, how to formulate your question, how you might want to structure your literature search, and we'll talk a little bit about that today. But I think it's a good place to kind of, to look at as a starting point if you're not very familiar with the systematic review methodology. And I have to mention that the library resources do look at all sorts of aspects of a systematic review. So they cover even things like, trying to find full text for the articles that you might want to end up extracting data from, or even, how to search for grey literature, which I've already mentioned I don't do. So it's a really good kind of range of different materials. And the other thing to think about at the very, very beginning, when you are thinking about formulating your review question, obviously is to use existing literature, as we've already mentioned, to do a bit of a scoping search. And that scoping search can include individual papers, so individual studies that have been done in the area before, and what they discovered, but also systematic reviews. But I think you can very much rely on your expertise as well, or expertise of your peers or supervisors, if it's a student project that you're doing. And in terms of that scoping search that I was talking about, it's something that really helps you refine that review question at the beginning. So if you, for example, look at individual studies, original studies that have been done before in an area that you want to review, then you can look at the type of, first of all, the kind of the research questions that they had, so kind of maybe particular aspects of the broader focus that you want to have, and what type of methodologies they used, whether they have general population comparison samples, for example, or not. So all of these sorts of things you will have to think about in terms of creating your own search strategy. So it helps you to see, I guess, kind of the broader landscape, I think, of the research in that area of focus. So it helps you to see how people are doing the type of research that you want to review, and what's the sort of inclusion and exclusion criteria that you will have to apply accordingly in your own search strategy. And to do a scoping search, you can obviously go to those sources that I mentioned before, like Google Scholar or Prospero, for example. And you can just type in, some very, very kind of simple, basic terms that are to do with your topic of interest. Excuse me. So I will be during the session, I will be using one particular example of a systematic review that I had done together with, my student, actually the student I was supervising had done. I just supervised the project, so I shouldn't be taking too much credit for it. But the systematic review was looking at mortality, rates of mortality in autistic people. So to kind of to know what has been done before, obviously I knew some of the papers already because that's my area of expertise. But to kind of find out if these papers had been reviewed before, we just typed in, in our search engines, we typed in words like autism and mortality to just see what's been done before. And I'll explain here, if you're not familiar with the different syntax that you can use for searching these things, I'll explain later on what that asterisk means by the word autis. Any questions so far before I move on? No questions? All good?
All good, thanks.
Yeah, okay. Right, so something you can use to help you define your, create your search strategy is also different tools, excuse me, different, I guess, kind of design tools, I guess I would call them. And I'm not terribly familiar with all 4 of them, I have to say that. So I included here a link at the bottom there, which has a very good kind of a comparison guide, I guess, between the 4 of them. So you can have a look at that link, and some of these tools are better for some types of studies than others. For example, PICO, I think you can use for both quantitative and qualitative studies, but Eclipse, if I can remember well, I think that's maybe good for looking at things like, I want to say interventions. No, I think that's SPICE actually. I don't remember. I'm mostly familiar with PICO and Spider, those 2. I have used these 2 before myself. So they all, as you can see, the acronyms stand for the different kind of elements that you will have to think about in terms of creating your search strategy. So in PICO, for example, you will have to think about what's your population of interest, who are the people that, what's the group of people that you will be kind of looking at, what's the intervention maybe, or the indicator for your outcome of interest, and what might be the control groups, comparators that you will be using. So to give you an example from practice, this again is kind of using that project on autism and mortality that I was talking about. And here we were asking in this review about the rate of all-cause and cause-specific mortality in people with autism compared to the general population. That was one of our review questions, not the only one, but one of them. So, of course, our population of interest was were people with autism, autistic people, and we looked at all ages and ethnicities. Our outcome was death, so we wanted to know how many people had died. And the indicator of that outcome was either all-cause or cause-specific mortality rate, and this could have been expressed in reported in a number of ways. So using descriptive statistics, but also standard mortality ratios, hazard ratios, odds ratios, so a number of inferential statistics as well. And then we definitely wanted to include studies that that had the general population comparison group. So any studies that wouldn't have had that in any way, wouldn't have reported that in any way, would have been excluded from the review. So hopefully that kind of illustrates a little bit more how you can start thinking about planning your own kind of focus of your own review, and how you can start designing it. And some of the other tools also let you kind of think about, I think Spider in particular, if I remember well, lets you think about the type of design of the studies that you want to review. So you have to specify whether, for example, you're looking at qualitative studies, or whether that would be observational studies, that type of a thing. Okay. All right. So now a little bit, since we've talked a little bit about designing the review, now let's talk a little bit about actually using different search techniques. So there are different, there's the Boolean phrases that you can use in your in designing your search terms for your review, and you probably have heard of it before if you have, you know, if you have heard of a systematic review at some point or another. But it basically means that you can use kind of linking words. I call them linking words. I don't know if that's a technical term. The librarians are probably the best people to ask about the technical term here, like or, and, or not. And they're all used for different purposes. So you can combine your search terms with an or if you want to use different synonyms for the same kind of a thing, the same kind of a phenomenon, or the same kind of a concept. Or if some of these words maybe have kind of different spelling, or there are acronyms for them. So here I gave you an example of different words that I might want to look at in terms of autism. So I have that word autism again with the asterisks, and I'll explain later on why that is. The Kanner syndrome as well might be another thing. ASD, which stands for autism spectrum disorder, or Asperger syndrome, is another way to talk about autism. So all of these I would be looking at in my review on autism and mortality. The word and can help you increase specificity of your search, and it's to do it's used to look at kind of the core concepts in your search. So you use that word to make sure that you include all of the concepts that you want the relevant papers to cover. So if I'm looking at rates of mortality in autistic people, then I want my papers to mention both any kind of word on autism, excuse me, and this could be one of these here above that I've listed, and also in mortality. The last option here, not, is something that I've never ever used actually, and I had a look at the library resources, and the college librarian doesn't actually recommend using not. I'm guessing it's because you just might lose some relevant papers, or terms that you might not have actually thought of as being relevant. So I would probably just follow that advice. But again, actually, I've never had the need to use that term. Some other strategies to make your search terms more specific is to use word proximity. So that strategy allows you to look at words in the vicinity of each other. So if I'm looking at autism and mortality, I could search for that phrase, and in that case, most of the time, following the right syntax for different databases, I would probably have to put that phrase in quotation marks to search for the phrase as a whole, autism mortality, but that will only pick up those papers that actually mention autism mortality in that form. It will not pick up any other variations. So it will not pick up things like mortality in autistic people, maybe mortality in autism, that sort of a thing. But if I use word proximity searching, I can do that. So here I gave you an example, and again, I've got this word autism with an asterisk, and that means that I'm looking for all sorts of variations of that word. So I'm looking for autism, autistic, autism spectrum disorder adjacent to mortality. And the number 3 kind of signifies how many places around that word you want to look at. So you can kind of say that these words might be closer to each other or a little bit further apart. So you could put for example, put ADJ2, and that means that the words are closer to each other. And it's worth remembering that different databases use different syntax for that, but I'll show you a little table in a minute in the next slide to explain that a little bit more. And some databases actually don't support it at all, which I didn't know before I looked at the library resources. But all those databases that I've used personally in the past have actually had that function. You can also truncate words, and this is where that autism and asterisk comes in. And truncating words is useful for searching for singular or plural versions of a noun, for searching adjectives, for searching adverbs. So different kind of variations of the same word, basically. So if I want to search, I gave you an example here on autism, but if I want to search, for example, let's say for, can't think of another word, maybe the word mental. If I want to search for mental, mentally, what other variation of that word might be? Well, hopefully it gives you an idea. You can put an asterisk at the end of mental and it will pick up mental and mentally at the same time. You can also use something that's called wildcards, and that lets you search for different spelling variations. And I'll come back to that just in this next slide. So here you've got a table that was prepared by Paul Cullen, the college librarian, so I can't take any credit for it at all. And it shows you the different kind of ways of, the different type of syntax you would use to use these different search strategies to make your search more specific. So you've got Ovid, which is used for Medline and Embase, to host Medline and Embase. You've got EBSCO, which is used for Sonal or PsycInfo. Then you've got your Web of Science and Cochrane Library. And here you can see that you use different signs, basically, to use these different strategies. So, for example, for truncating words, in Ovid, you can use either the asterisk or the $sign. In the other three platforms, you use an asterisk. And the same for wildcards. And here you've got two different options for wildcards. So the first option for wildcard, where mandatory one character is kind of interchangeable, we use either the hashtag sign or the quotation mark. Not the quotation mark, sorry. Oh my God. The word escaped me now. You know what I mean.
Question mark.
Yeah, there you go. I was going to say exclamation mark, and I was like, no, that's not the one either. Question mark, there you go. In that first option, where you looking to have a wildcard for mandatory one character, means that you, for example, look at words like synthesize, spelled in American or British English. So only one letter there would change. So you would have either S or Z at the end, right? Because it's a different spelling. In wildcard, in the second wildcard option, where you have either 0 or 1 character, you might be looking at words like words that I probably hyphenated. That's probably a good example. So maybe, for example, well-being. I sometimes have seen this word with a hyphen for some reason. It does look quite strange, but some people spell it that way. So if you wanted to search for both well-being with a hyphen between well and being, or well-being just spelled as one word, then you could use that function, that strategy. And again, for proximity, you can see that there's different syntax to use depending on the databases. So my advice is to always check the type of syntax, that is the type of language that each database uses, because for example, you know, if you use an asterisk in a place where you're not supposed to use it in Ovid, the search just won't work. Basically, it won't work. Not, at least not like you would want it to work. Any questions so far? Because I feel like this is quite complicated, this part. No? Okay.
Just where would we find this table? Is it something you're going to share with us, or?
Well, so this comes from the different library resources, this particular table, but the syntax, if you're asking about that, the type of syntax that each database use, I think you would just have to search for that specifically, depending on the database that you want to use. So there are whole websites, you know, if for example, if we're talking about Ovid, there's a whole website that's designated to Ovid specifically, and the different kind of acronyms at the end that you can add that let you search for just title and for just different search terms in title and abstract only, which I'll come back to in a minute. All of these sorts of things, they are just presented, kind of outlined on the website for those particular databases.
Okay, thank you.
So this video, I think, I'm not going to play it for you, but I would definitely advise to watch in terms of increasing this, trying to increase the sensitivity of your search strategy. I find it very, very useful when working with students, for example. It gives you a great overview of how the whole process works. So just a recommendation. There's also something that's called subject headings that you could include in your search strategy. And it's basically, the way it works is that it's not the search terms that you're actually looking at when you're at subject headings. So it's not the words that you think might be appearing in the actual text of the relevant papers. It's the subject headings that are used by people who run the databases and who update them and maintain them. So whenever an item, an article or any other publication gets added to a database, a person who's indexing that item will be deciding which topic that paper covers, basically, and they will assign a subject heading to a particular paper. But it's worth remembering that the subject headings usually actually don't really match up to the keywords that authors all are required to include in their papers. So the fact that for example, a paper is on autism, and that might be one of the keywords that the authors chose to categorize the paper, will not mean that there's a subject heading that's called autism in that particular database. There might be developmental disorders, for example, a subject heading like that, or pervasive developmental disorders, which is another way to describe autism. But basically, these two don't have to be the same. They are synonymous, but they don't have to be the same. And here I gave you an example of how these subject headings might be different as well between the databases. So, for example, for autism in Medline, hosted on Ovid, because Medline is hosted on different platforms, in Ovid, there's a subject heading autism spectrum disorder. In Sinal, or Sinal, I never know how to pronounce that name, it's autistic disorder. So you can see that these are two different subject headings, but they both mean the same thing. But basically, to run my search, I would have to use these different subject headings accordingly. So I would have to adapt the search strategy and change the subject headings for, depending, which database I'm running the search on. And here is an example from my own, well, again, the same review that I was talking about that was looking at mortality in autism. And this is an example for Ovid. So we ran the search on Medline and Embase. And here the first line is with that kind of stroke, that signifies the subject heading. So there's a subject heading that we found that was relevant to us. The second line with the MP letters at the end means that we're searching for that particular search term in the whole text of the paper. What else do we have in here? MP, I think that's all. And basically lines 1 to 14 are different ways of describing autism. All of these terms would have been used at some point in the kind of trajectory of this research to talk about autism. So line 15 is saying that we're looking for either this or that, or the other. Then the next concept that was very important to us in this review was, of course, mortality. And again, we have all sorts of different synonyms that describe mortality or dying. So we included all of these, and we summarized, we kind of then said that we were looking for any of these in our search strategy. And we also specified that it had to be deaths in humans. So we added in line 32, we added a subject heading that was to do with human studies. So we didn't want to look at any deaths in animals because there are quite a lot of animal studies in autism research. So that's also possible to include in your search strategy. So that's just a kind of a brief example of my own work. Hopefully that illustrates a little bit more what the search strategy is about. Okay. And I'm not going to go into how to run a database search because we just don't have enough time to do it, and it works differently on different databases. But just to give you just to kind of refer you to useful resources. This is a link to, again, a video that's been done by Paul Cannon, the MBLS college librarian. And there are different videos there for different databases. So I believe there's one for EBSCOhost, which has SNOW and PsycInfo. There's one for Ovid, which has Medline and Embase. There's maybe one for Cochrane database as well. I can't remember, but in any case, have a look at these. They just show you basically how the search works in practice, how to run it, how to input your search lines, your different search terms, and how to run the search as a whole. You can also use in your search strategy words that are called limiters. That means that you can either time limit your search, or you can limit your search by language. You can limit the search by age, by the type of methodology, this sort of a thing. And some of the databases have tick boxes where you could choose, for example, a different type of methodology that you're interested in, or a different kind of developmental stage. So maybe you're looking at childhood or young adulthood, that sort of a thing. But the advice, I think, from the library that I've been given in the past is not to use those. So not to tick any of those boxes because they're just often not sensitive enough. What I instead try to do is to use subject headings that are relevant. So for example, again, if I want to look at human studies, I will just add that subject heading as one of my lines in my search strategy. And I would also say that only use limiters if you really have to, because remember that if it's a systematic review, it is supposed to be systematic, it is supposed to be comprehensive in nature. So you want to make sure that you don't miss anything that's important. Again, I'm not going to go into how to use EndNote because that could be a session on its own, I feel. But just to refer you to some resources, there's a really good guide to managing references in EndNote, so you can have a look at that. I also provided a link as to where you can get the software if you need to, and I think it's available to, I think you can use the desktop version of it if you're a staff member or a postgraduate student, so that's available for you. One piece of advice is to always remember to remove duplicates in EndNote, because if you're running your search on different databases, let's say you've got 4 different databases, then oftentimes, especially if you, for example, if you look at Medline and Embase, which are both hosted on Ovid, there will be a lot of overlap between those search results. So make sure to remove those duplicates. And the same, for example, for EBSCOhost, if you want to look at PsycInfo and SNOW, again, you will get a lot of duplicates between those 2 databases. So make sure to remove them before you start reviewing your titles and abstracts. Reviewing titles and abstracts, speaking of that, and full text of the papers. If you want to publish your review, you will need to have at least 2 reviewers. It's just standard practice. 1 reviewer is not enough. So that's something I think really worth remembering for student projects, especially for masters, excuse me, or BSc projects, for example. if students want to publish, they will need to have a second reviewer. And oftentimes I would say, you know, that there's no specified number of kind of selected text that you have to have a double review of in terms of titles and abstracts. But if you want to publish, I think 10% is probably minimum. A lot of the time I see, you know, where the number of results is a little bit more kind of manageable, I see that people have double reviewed all of the titles and abstracts. But obviously that's not possible, you know, if you're looking at 15 or 13,000 of search results. It's just, you know, it requires too much time and too many resources to do that a lot of the time. So I've published with 10% of randomly selected kind of double reviewed titles and abstracts before, and that has been acceptable. So again, I'm just speaking from my own experience. You might find different advice online. Quality assessment is something that you have to do kind of towards the end of your systematic review, really. You will have to assess basically how good or how bad the papers that you end up extracting data are. So any of those papers that you actually include in your systematic review, you will have to do a quality assessment of. And there are lots of different checklists available. So I'm not going to, you know, I'm not going to, I guess, recommend one or the other. It all depends on the type of methodologies that these reviewed studies will have. But just to tell you that CASP checklist or Joanna Briggs Institute checklist do cover a wide range of different types of methodologies. So you will find kind of relevant checklists for qualitative studies, for observational studies, that sort of a thing. So it's kind of, if you've not done this before, then you might want to check out CASP and Joanna Briggs first. And again, if you want to publish your review, then I would say that you do really need to have a double review of all included studies, or all of those studies that you actually extract data from. Just remember that, you know, if it's quite a lot of papers, you could have, if it's possible in terms of resources, if it's possible to have 3 reviewers, then you could always have, you know, that double review, you could split between those 2 extra reviewers. So one of them can double review, do the double quality assessment of half of the batch of papers, and the other person can do another half. So that's possible. And one last thing, I think, is iterator reliability. So that's something to look at in terms of the level of agreement between reviewers. And again, I think that's best to have, I kind of recommend it to have if you're looking to publish. If you're not looking to publish, if it's a master's project, then that's probably not always necessary. But I do tell my students anyway, those ones who want to know about it. So you can basically calculate at the title and abstract review stage, as well as the quality assessment stage. That's kind of the stages I've done. I've not done full text review stage before, but you can calculate what's the level of agreement. And to do that, you use what's called a Cohen's or Fleiss's kappa statistic. And you can use statistical software to do it, or you can actually find online calculators to do it for you really quickly. But in the past, I've also used SPSS, and it's really easy to do. And if you've got any questions about the process, you can always email me, and I can explain it to you. But Cohen's kappa is used to calculate iterator reliability between 2 reviewers. Fleiss's kappa is always more than 2 reviewers. So, for example, if you've got 3 reviewers involved in your systematic review, then you would calculate the Fleiss's kappa. And last but not least, Prospero registration. Excuse me. So it's something that you will need to do if you want to publish. You will have to have a registration number, which you will then need to quote in your manuscript when you submit to a journal. And I'm mentioning this at the very end because you will have to think about those different kind of elements of your search strategy. So you will need to know what your review questions are, you will need to know what's your population that you're looking at, what the outcomes are, what the measures might be, what the comparison group is, these all sorts of things, apart from all the kind of logistics in terms of, you know, who's part of your review team, because you will need to provide names and contact details for people as well. But you actually register your review prospectively, so you do it at the beginning. So you will need to come up with a full search strategy, then register your review, and then kind of, you know, start doing it. Obviously, the scoping search will come first, because you will want to do a bit of a scoping search to plan your search strategy. But it's best to register with Prospero kind of early on, in the early days. And here are my contact details. And as I mentioned, I'm now at Edinburgh University full-time, but I still use my Glasgow email. So whichever one you use, I'll reply if you've got any questions. And we do have a few minutes for questions. So I'm just going to stop sharing. If I know how to do that. Okay. Yeah, we've got about, I don't know, 7 minutes, I think, for questions. So feel free to ask me any. So I've got some questions actually in the chat function. So it was a question about the asterisk, what it means. Hopefully I've answered that already. I would say you can't really use it with all of the words. It's those words that will have different kind of variation of them. So it's a kind of a family of words, if you like, that you want to look at. So those words that have a noun, possibly might have a verb, an adjective and an adverb. So I can't think of a good example right now, but maybe like something like maybe draw. Let's say draw. You can have draws as a plural, I guess. You can have drawing. You can have, what else? There's no adjective there, but hopefully that gives you an idea. And the other question is quite specific, so I'll maybe answer that in an email separately to this person. And there's one question from Becca. Do you need to calculate inter-rater reliability to publish? I have done it before without, I think, including this information, and the reviewers haven't picked up on it. So I guess it is possible, and I definitely have seen systematic reviews without this information. But I guess if you want to, I mean, it's a very simple actually process. Once you get your head around it, it is very simple to do. So it's always probably best to have it rather than not, I would say. Okay, yeah, no worries. Shall we start with Hayley? Because Hayley and Daniel have their hands up. Yeah.
Yeah, I just have a question about Prisma diagrams. So I've always understood the Prisma diagram to be a result, so sort of filling in all your numbers that you've gotten from your search strategy so that it would appear in the results section. But I found in supervising students, quite a lot of them have been advised in the past to put it in the methods section. So I just wanted a bit of clarification on that, because to me it's definitely a result, but yeah.
I would say it's a result as well. But I have seen it. I actually had a student who put it, to start with, who put it in the methods section as well. And I have heard colleagues arguing that this is your methods. So the number of search results you retrieve, etc. That's your methods. But I would say that's your results. I think it's probably, it's one of those things that you could just interpret in two different ways. But I personally have always reported it in results. Yeah.
Okay, thank you.
No worries. And Daniel?
Yeah, thanks for that. It was very useful. My question is about how to make things more manageable if there's a time limit for the review. So the obvious example being a master's project, but it may occur at other times. So what would be your advice so that it doesn't take 2 years to do?
Sure. Yeah. I mean, you know, having said that, I did have students. I still supervise students who are doing systematic reviews within a year, so it is, you know, it is doable. But what I often say to them is that they really need to think about, because oftentimes they're not looking to publish. Let's be honest. So I just tell them that they really have to think about their search strategy and run some trial searches. So once we do have a draft search strategy, I ask them to just run some trial searches on a couple of chosen databases and basically see how many results they're getting. And if it's a master's project and they are getting 10,000 search results, it's just not manageable. It's far too many. I always say I kind of aim for up to 2,000 search results, and that's still quite a lot for a student project. But I just do it like that in very, I guess I just discuss it in very practical terms. It's not a very scientific way of doing things, for sure. But I guess you do have to limit your search to, in some ways. You can't do a proper systematic review in a year's time if we're looking at, reviewing 13,000 up to 20,000 search results. It's just not doable. And it's unfair to kind of expect that from a student anyway. So I just tell them to kind of limit the search terms that they include and possibly maybe limit the number of subject headings, apply some limiters. So for example, you can look at the last 10 years of papers, if there's a good justification to do that. For example, I had projects where students had looked at different neurodevelopmental conditions and the kind of the diagnostic categories changed, from one DSM to another. And so I just told them, let's look at the last 10 years or like 20 years, whenever the DSM-4 started, that sort of a thing. So, for example, we wouldn't look at any historical terms, for intellectual disability or autism. Yeah, so hopefully that answers your question.
Yeah, it does. Thank you.
No worries. Any other questions? No. I don't know about the slides from this session. I know it was recorded, but I will maybe send the slides to Audrey as well, in case she wants to kind of publish them somewhere on Teams or wherever it's most suitable. But yeah, if you've got any questions to me, just feel free to email me. Okay, thanks so much for today. Hope it was useful.
Yeah, thank you.
Thank you.
Thanks, bye.